Hello, my name is Abraham Lee, and today I will be presenting on the various activities of communication that were held during orientation and how they relate to medicine, as well as the transactional model of communication and how it relates to medical practice. So the first activity that was held was a basic interview between an interviewee and an interviewer. The purpose of the interview was to retrieve information on the basic background and personal life of the interviewee and their feelings based on the various activities held during orientation. And so, how this relates to medicine is that in the examination room, the patient and physician interaction is very important in terms of their communication. And so, the physician needs to ask the proper questions in order to receive the proper basic necessary information on their background, their personal lifestyles, their dietary changes, their allergies, their major accidents or surgeries in order to create that proper diagnosis for the patient. The next activity that was held was another interview process in which the interviewee talked about their volunteer experiences. In this second activity, we looked more at the interaction between the interviewer and the interviewee, whether the interviewer was taking proper notes during the interview, and whether they were picking up the nonverbal cues of the interviewee, and also making sure that the interviewer was keeping proper eye contact and keeping proper transition phrases in order to keep the conversation going. And this is important in medicine because if the physician is not able to pick up on nonverbal cues or maintain eye contact, it messes with the communication with the patient, and the patient does not feel as connected in this patient-physician interaction. And the last activity that we did was a dramatic storytelling in which the group was supposed to pick one of the members' personal life stories or backgrounds from the first activity and kind of do a dramatic interpretation in front of an audience. And so, how this relates to medicine is that basically, when you're able to communicate to a wide audience and do public speaking, helps you become more comfortable in terms of your communication skills. And so, this is important in the hospital setting when you're talking to various patients, talking with your colleagues, other physicians, you're working as a team, and you're able to communicate effectively and not be scared when you're speaking in front of others and just being comfortable in front of an audience. And so, in terms of the transactional model of communication, I have a little illustration here where you see a physician speaking to a patient, the man, who has a thought bubble on top of his head. So, in terms of the transactional model of communication, you have simultaneous communication between one person and another, or it could be a group of people. But in these kinds of interactions, you can see interruptions, which is also known as noise, that can happen. So, in the hospital setting, a nurse can possibly walk into the examination room during the interaction, or other family members in the examination room can interrupt. So what's really important is for the physician here, the doctor carrying the manual, for him to effectively pick up on the nonverbal cues of the patient, to really know how he's feeling, and for the doctor to be empathetic. And the patient can be having mixed reactions based on maybe his diagnosis or basically on the presentation of his symptoms. So the doctor is required, and he needs to be able to communicate effectively with the patient and create that relationship where the patient feels comfortable enough to share personal information to create a necessary diagnosis. So that's my presentation, and thank you for listening.